to help get their workers back to the rigs and keep their ships up and running. So sticking with our paradigm of what we need to do to get people back to the work site. The IOGP, the Institute for Oil and Gas and Petroleum, laid out position statements on what is necessary to get people back to work. And we helped one of our clients implement those. First and foremost was to update their policies to make sure that there were leave policies in place and there were staffing policies in place. So if someone did get sick and was not able to come to work, that there were contingency plans in place. Second was the idea that if someone started showing symptoms of COVID-19 while on a ship or a rig, that there were quarantine facilities available, and there was a plan to get that person tested as quickly as possible. Those had to be built out early in the pandemic, and we were able to help facilitate that. As we moved forward, we went to a more proactive screening process. We helped set up systems where employees who were returning to the oil rigs were quarantined and tested with a PCR test 72 hours prior to being deployed. And then once they were on site, we were able to use our virtual health systems to make sure that anyone who started developing symptoms had access to virtual healthcare and in-person healthcare on the rigs to decide who could stay in quarantine, who needed to leave, be tested, who needed to be evacuated to actually have in-person healthcare to manage their symptoms. This was a very successful plan that has helped keep our client up and running and even win more business and put more rigs into play over the past year. Moving on to our next slide. So this is once again an overview of what we're able to. We assessed their document procedures, established isolation. We were able to get protective equipment for clinicians who were positioned on those oil rigs and those ships and help keep everyone safe. Pre-deployment screening tools were used. The My Wellbeing app was one, but there was also a virtual health assessment, a screening that was done prior to deployment to make sure that we were not putting anyone at risk, that we were aware of their medical conditions, as well as the medical conditions of anyone that might be at home that might factor into this employee's ability to be effective at work and re-engage in a work site, as well as an evidence-based testing strategy which allowed us to use the tests only when needed and not be overwhelmed.